Hi folks, welcome to Cancer Healing Vlogs. So today's day was, being a Saturday, it was like a half day and we had like a few things that I could do, but mostly I was trying to focus on learning as much as the slide work. I'm done with the thesis submission, just very few odd things are left in that aspect of my work right now. Thesis submission, as you probably saw in the previous video, if you did, which had a lot of that part of the entire month went in that activity. Uh, right now, we want to talk about one of the slides that I looked at, and I was kind of revising the facts about it. Is reactive lymphadenitis. This is basically a very common finding in histopathology, even on cytology actually. And on histopathology, what I the slide that we got is basically of a lymph node. When a lymph node, lymph nodes are present all over the body, and when at times it gets enlarged, it could be anything from a simple infection to even a cancer, which is why you need to differentiate, and that's where the biopsy is taken. So one of the biopsies of a lymph node that we got turned out to be a plain inflammation, because of which it was called reactive lymphadenitis, an inflammation because of reaction to an infection. So the way you diagnose it, some of the major features that we know that we have studied for reactive lymphadenitis is there will be the follicles that are present inside the lymph node will be of different sizes, and there will be lymphocytes of there won't be any cancer, those atypical cells will not be there, but there'll be lymphocytes. Then lymphocytes will be of different stages of maturation. Some will be very large, some will be small, and depending on the type of lymphocyte. So if it is a smaller one, it could be a centrocyte. It's got like it's got a groove. It may have a central groove in its nucleus, and then there is centroblasts, which are larger, and then there's immunoblasts, which are even larger than that. Those type of lymphocytes, and they have like the centroblasts have a larger nucleus and prominent nucleoli as well. Then there are also presence of macrophages. Macrophages are the largest cells amongst these type of activate. They are basically activated. The macrophages are monocytes which are basically activated, right? And if they are present, they will have like an eccentric nucleus, and then they're tingible body macrophages. They will have like a lot of granular appearance. So that is one typical feature of reactive lymphadenitis. There are 4 types actually of reactive forms in which it can present. Reactive lymphadenitis can present. One is the most common one. There's the follicular hyperplasia, so increase in the number of follicles, and all the centrocytes, centroblasts will be present. Then there is also the paracortical hyperplasia. So the area between the follicles is the paracortical area, and there the presence of lymphocytes will also be there, and there will be increased number of lymphocytes in that area as well, and especially the larger type of lymphocyte, the immunoblasts, will be present in that region. And the next type will be the sinus histiocytosis. So sinus are the vessel linings in the area of the lymph node, and if that sinus has got histiocytes present in the histiocytes will become increased in number. Hyperplasia it will undergo. So sinus histiocytosis, it will be the sinus lining will be very prominent and will be full of histiocytes. So that's another type of reactive lymphadenitis. These are 3 types, and then there's mixed, which has got a variation of all 3 types. These are the common variations, but the most common one will be the follicular hyperplasia, where just increase in the number of different sizes of follicles. So this was one common thing that we get, and I thought I'll just share that as well today with you. It is important to recognize these from cancer, like a lymphoma or any other type of atypical cells. Here, to recognize a centrocyte, a centroblast, an immunoblast, that is important. You can just Google an image of a centrocyte, centroblast. It'll be easy enough to understand. Centrocytes generally have less cytoplasm. Centroblasts have a little bit more. Immunoblasts have even more. So yes, just a few things just to share with you. Hope this is of some value to you. Cheers. Thank you.